I'm Andrew Cameron. I'm the CEO of FeelTect. So FeelTect is developing the first connected health technology for measuring and monitoring compression therapy, primarily for the millions of people with venous leg ulcers. So I did the BioInnovate program in 2016, 2017, and it's been a roller coaster ever since then. I think that what BioInnovate helped me to develop was this confidence that there was enough versatility that we could always overcome a problem as long as we understood that problem comprehensively. So we were looking at different clinical needs in the cardiovascular space, both in the Irish ecosystem, but also over in the Mayo Clinic. And it was actually while I was in the Mayo Clinic, we spent some time in the wound care centre watching these people come in with these terrible wounds on their leg. And some of them had been present for years. So we didn't know anything about venous leg ulcers at the time, but the way they were treating them in the Mayo Clinic was to hook them up to this big pneumatic sleeve that was then hooked up to a compressor in the wall. That actuated the leg, it restored the blood flow and healed the wound. It was quite effective, but extremely cumbersome. And so we had these notions of, how could we make something more streamlined, and could we make something that people walk around and it actuates their leg? But we came back to the University of Galway and we talked to the head of nursing, Professor Georgina Gethin, and she said to us, look, we don't need anything as complex as that. If we just had a way of improving traditional compression therapy, that would have a huge impact on patients and the healing outcomes. And so that's what really sort of set our path forward for how we developed the solution to that need. Our vision is to use connected health technology and the data that generates to redefine the standards of care for millions of people with wounds. TighterRight is a connected health platform for measuring and monitoring compression therapy. It's comprised of a wearable device, and then that actually sort of transmits data to a mobile app, so you can see the pressures while you're applying the compression bandage. We also have a digital platform, and what that provides is that opportunity of remote monitoring, self-management of the patients. For the patients themselves, beyond having an accelerated healing, there's an empowerment to the patients, and it's their ability to actually become engaged in their compression treatment that means that they're not being defined by the wound, they're helping to control the treatment.